So I will be talking about platelet-rich plasma in tendon injury in tendon. As we know, the tendon structure is more like a nerve. So you have these fibers, then you have primary bundle, secondary, and then you have complete tendon. Now, in a tendon, the amount of cells are less. So basically, it's a low cellular density in the tendon. And the main cell is the tenoblast or tenocyte, which constitute 90 to 95% of all the cells. They also have synovial cell, which are usually present in the covering of the tendon, and where the tendon is inserting over the bone or any epineurotic junction, they also have some chondrocyte and of course some blood vessels and of course some nerve cells. So what happens when there is a tendon is abnormal, the many changes might happen. It may lead to either like the collagen fiber, they may be disorganized, the cell content in the tendon may be more, or the tenocyte shape might also be altered. There may be calcification, fat deposition, or so this is a normal tendon, how it look like, smooth, glistening, and less cells. And here how the tendinopathy look like with increased cellularity. They have been given in the past various names like Reiter cramp, lawn tennis, and as I said, they are more common non-athlete and they are more common in the dominant arm. Now, during initial stage, we try these like this is called price, in which we add medicine and different modality. Discuss how PRP is helping in the tendon disorder. So actually, it has been shown that the PRP has a synergistic effect with the tendon stem cell or progenitor cell. So PRP, we know that they have growth factor, and in previous slide, we have seen those growth factors, they help in the tendon healing. So PRP also help in differentiation of the tenocyte towards the tenocyte, not towards the non-tenocyte. They also help in gene expression and they also help in increased production of collagen 1. Is there any evidence? Well, these are the latest study and I put them in the table. So this is basically the latest systemic review and meta-analysis published in 2018. And they just included the level 1 study. There were 21 studies and they show in the result that the short-term result and the long-term result, it reduces the pain. But this reduction in the pain work only for tennis elbow and the rotator cuff. Then another article is by Eric Chakran in 2016, and they also included randomized control study. There were 10 study and it shows basically they compare PRP with the steroid and also with the autologous blood. And they found that the PRP is better than the autologous blood and autologous blood is better than the steroid. When you use the whole blood, then the pain and swelling is more in comparison to the PRP. So it reduces pain and it reduces and improve the score. Then another study in 2014 by Morris, they included 19 study, but not all of them were level 1. And he suggested that there is no difference between PRP versus alternative therapy, whether you use physio, whether you use saline or any other conservative. Then Rath used another meta-analysis they done in 2015 and they included both level 1 and level 2. And they also found that if you are using PRP in a arthroscopic repair of full tear of the rotator cuff, when you apply PRP at the junction of tendon to the bone, it helps. But when you apply over the surface of the tendon, it doesn't help. And there's no statistical significant difference between the overall outcome or the re-tear rates. Now we come to the another two common tendinitis is the patellar tendinitis and Achilles. And I again put them in the table. So in 2019, the Alex did a randomized study and they basically did on 57 patients on each group, chronic patellar tendinitis. and they found that there's no difference at 12 week or after. Another study in 2017, they basically did a systemic review. They included 15 study, and they found that if you use PRP or shock wave, either as a main or as a adjuvant, it help in the early recovery. And the steroid, they should not be used. For the Achilles, DVOs have done randomized study, 54 patients, and they found there's no difference on ultrasound if you compare the thickness of the tendon or the density of the tendon, and there's no difference in the score. Another meta-analysis by Liu, and they also found there is no difference. So we can see the literature show that there is a improvement if you use PRP for patellar tendinitis, tennis elbow, and rotator cuff. But for the chronic tendinitis, degenerative, Achilles tendinitis doesn't help. Now these are our patient. This is a 23-year-old male patient having Sinding Larsen syndrome, and patient was having constant pain in the lower part of the patella where the attachment of the tendon is there. He was not able to fully extend the knee. He was not able to do running or do some sports activity. And there are slight irregularity in the tendon. And this is the transverse section and ultrasound, how it looks. So in this patient, I use leukocyte-rich PRP, 3 injection at weekly interval. So this is the way the needle directed at the attachment of the tendon over the patella. And on the axial section, this is the needle, and then we inject under ultrasound guidance. This patient, when you inject inside the tendon, the PRP, it's very painful. So for first 1 or 2 days, the patient has a lot of pain. We usually recommend ice application. We don't recommend any non-steroidal anti-inflammatory because it will act against the PRP. So 1 gram Panadol or paracetamol 12 hourly for 3 to 4 days. Then usually the effect come around 3 months and the patient was able to resume the full extension, started jogging around 3 months. Still not playing football because I'm putting him is more on strengthening of the quadriceps, and on your hamstrings are also tight because he was not extending for for the long time. So he's working on his hamstring. This is a 15-year-old child who's having Osgood-Schlatter disease, and on X-ray and CT, there was still some translucency at the junction where the tendon come and attach. But in this patient, because there was a translucency between the parent bone and the tibial tuberosity, I combined both PRP and BMAC under fluoroscopy, and he is doing well and he is playing football. Before he was not able to do running. Another patient with tennis elbow for 6 months, failed treatment, failed physiotherapy, and he tried depot also steroid, didn't work. So in this patient under ultrasound, I gave single injection, leukocyte rich. So this is the area in it, you pass the needle, subepineuritic area. This is the needle, and then you inject under direct vision the leukocyte rich PRP. This patient did not show any improvement for first 2 weeks, and around 3 months he started showing good result, and now he's playing. We can also use it for shoulder. Usually the patient, they come with the biceps tendinitis, like they see some white, you see this white edema fluid collection around the tendon. Sometimes you also have changes in the bone also. So in the shoulder, like this patient, 28 with supraspinal tendinitis, biceps tendinitis. So under ultrasound with the needle, we first go for the biceps, then for the rotator cuff, then also at the attachment at the end plate. And again, the improvement usually come around 3 months, the full result. After second injection, they have some improvement.